This is Local Edition. My name is Brad Pomerance. My honor to introduce you to Dr. Craig Salcido. He is an OB-GYN at Mission Hospital in Mission Viejo, part of the St. Joseph system. I was born at St. Joe's in Burbank, so it's always good to see a St. Joe's doctor in our midst. Tell us a bit about St. Joseph's Mission Hospital, where you serve, before we get into your specialty.
Sure. Mission Viejo, California, serves anywhere from, it's mostly South Orange County,
right,
from Oceanside, San Clemente, all the way up to kind of Irvine area.
Right.
But we attract patients from everywhere, even as far as LA.
And what's nice is, like you said, because you're in South Orange County, you also get North San Diego County, yes, coming to your facility. Give us a sense about your expertise. You're an OB-GYN. That practice is changing every year. I can't believe how much it changes, even from when I had kids in the last decade. So give us a sense of your practice and the specialty that we find at Mission.
Okay. OB-GYN is always changing. We're getting more and more people coming to our appointments with greater and greater knowledge, right, from the internet and apps.
A little knowledge is a dangerous thing, doctor.
At times, yes.
Right,
yes.
Right.
But for the most part, it's very encouraging because it enables us some time to discuss with the patients the plan of care, what their expectations are, and it always leads to just a better communication between doctor and patient.
Yeah, so do explain to us how that access of information informs your practice, because like you just said, with the internet, we do have a lot of knowledge at our fingertips. Yeah, I don't know if there's fake news in your arena, but you know where I'm going.
Right. Yeah, no, hopefully not. There's, you know, at times we do have to kind of filter through some, you know, misinformation, but the reality is most information is really good, and at least, again, it opens up the dialogue. Physicians use the information online. We have our own websites. Patients have apps that, like you said, puts the information right at their fingertips. And so when they're looking at what they have and they're bringing that information to our appointments, we have a conversation.
Right.
We talk about what their expectations are, how that information is pertinent to their care.
And let me ask, how have expectations changed? Because I have to think, I mean, you're a young man, but I have to think that maybe 20 years ago when you were, I don't know, in your residency, I'm guessing, that the patient was different.
Yes, you know, even in the 17 years that I've been in practice.
Perfect, I wasn't too far off.
You weren't too far off. I've definitely noted a change in the environment. People really want more of a natural approach to delivery.
What does that mean?
Well, you know, in the past, I think it was felt that there were a lot of interventions done with their care, additional monitoring, utilization of instruments for helping the delivery. But now, you know, I think patients are starting to realize that when they come to, you know, a hospital like Mission Hospital, that they're discovering, quite frankly, a lot of us as physicians and providers and nurses are seeing the patient for what their needs are and just recognizing that, you know, this is a natural process.
Right, although it's so interesting because with regard to many medical interventions that are necessary, we want the most up-to-date modern technology available. When it comes to delivery, nope, we want to do it all naturally, at least some. So it's that kind of push-pull.
And it's always a nice, valuable safety net. You always know that it's there, you know, and you can have very minimal intervention. You know, for instance, patients can walk around in the labor and delivery unit. We have these, you know, really exciting ways of monitoring the baby if they choose to have constant monitoring, where the mom can walk around her room while the monitors are on her. We can keep an eye on what's going on. Getting back to technology, physicians have apps on their phones that enable them to monitor the patient's progress and see how the baby's doing during the delivery.
Right. So how do you balance then that desire to keep it natural with the desire to keep both mom and baby healthy?
Well, that's the key element. You know, we're always monitoring both.
Right.
Mom's vital signs are always being followed. The baby's heart tracing is always being followed. Their progress. we're looking out not only for how physically they're doing, but how emotionally they're doing.
Well stated.
You know,
and I want to talk about emotions as well, especially post-delivery. What I want to ask you also is, there are some that may choose a home birth. There are some that may choose to have maybe a midwife present, a doula present, either at home or in the hospital. How do you work with those patients?
Yeah, well, you know, the Mission Hospital is, you know, really encouraged by using doulas. We have them available. I just did a delivery with a doula a week ago, and it was wonderful. Everything went well, and the doulas really act as a. Do you know the difference between doula and midwife?
Please explain for our viewers.
Okay. A midwife basically will provide a service very similar to a physician in terms of doing the actual delivery, and they can monitor, you know, the heart rate, how mom's doing.
Right.
A doula is there more for the emotional support, kind of in their ear, kind of holding their hand. We all work together. The midwives, the doulas, physicians, and nurses, we act as a team. And some people, they want to have a midwife, and others, they are happy with the care of a physician, but we're all there as a backup team.
I want to talk about the baby. You must be very proud that the World Health Organization recently declared your hospital Mission a baby-friendly hospital.
Yes.
What does that mean? What did you do right?
So that initiative is basically a designation whereby it's supposed to encourage breastfeeding immediately, and there's a lot of time, energy that goes into that. There's a process by which the hospital looks at their staff, their care, the nurses themselves, and the physicians, and then develops a plan whereby they can educate patients. There's signage on the walls that have you know, the benefits of breastfeeding.
My wife said to me that when she breastfed, it was really amongst her happiest, emotionally fulfilling moments in her life. It just was electric for her. The flip side, though, sir, is some women don't feel that. Not so much in regard to breastfeeding, but after delivery, they may start to feel the blues. And how, to the extent you do, how do you get involved in that postpartum depression that we hear?
Well, you know, sometimes it will kind of come really, the onset can be very quick, and we see it right away. Sometimes we see it at the tail end of the pregnancy with anxiety, some sort of depressive symptoms. But afterwards, sometimes the postpartum care nurse will see it just before the patient's leaving. We do an assessment.
Oh, I see.
And then they will immediately notify us. But, you know, there are things to watch out for. Family and friends should always watch out for you know, signs of mommy not doing well, not bonding with the baby, maybe having some issues with insomnia or anxieties going up. You know, if that ever happens, you tell your provider, and you go from there.
I want to thank you so much for joining us, taking care of moms, babies, and even dads like myself, and yourself as well. His name is Dr. Craig Salcido. He is an OB-GYN at St. Joseph's Health Mission Hospital in Mission Viejo, California. My name is Brad Pomerance. We're so glad you joined us on Local Edition.